Here we are with the femur, the biggest, the baddest, the longest bone in our body. If I asked you to defend yourself against zombies, you would grab this right out of a bone box and use it to fight them off. And this is the nice thing about the femur. It has such large markings that it's hard to miss them. So let's begin to describe, of course, as we always start off with laterality. What structures are there to help us to determine if this is a left or right? Well, very simply put, the head gives us two, both proximal towards you as well as midline medial. So the head is medial and proximal, and then of course you could take a look, well then which one is it? Is this anterior or is this side anterior if this was my body? Well, very simply put, if you see a gigantic line called the linea aspera, that is always posterior. So this would be considered a a left femur. So this is a left femur. So let's go over to some of the structures that we need to take a look at. So right here is the femur with the head. We've already covered that. And the neck, if I were to try to choke this out. And on top of the head is this little dimple. This little dimple is what we call the fovea capitis. Literally translated, dimple on the head. So fovea capitis. So we have the fovea capitis, the head, the neck, and then you have these two very large mountains of bone. This big chunk called the greater trochanter, this smaller one called the lesser trochanter. Now we find these two are connected by a couple lines. One on the anterior side is called the intertrochanteric line. On the posterior side, with this actual crest, you can see it has this big ridge called the intertrochanteric crest. So intertrochanteric crest, intertrochanteric line. On the posterior side, also you'll see again the linea aspera, but it flares out into these two kind of spreads, and on the lateral side, it becomes very rough. This roughened area is called the gluteal tuberosity on the femur. So that's nice. That's where your gluteus maximus is going to insert on. Some gluteal muscles, not just the maximus. But you'll see this is a place for attachment of the gluteal muscles. As we continue to move further down, we take a look at the distal end, and what you can imagine is there's a couple things. Keep in mind that this side is the medial side, so we travel this all the way down. So of course this side would be medial. We get two large condyles. This big large condyle, which is a smooth articulate kind of process, medial condyle, lateral condyle, and above them, these big knobs are called the epicondyle. So of course, medial epicondyle, lateral epicondyle. In between is this gigantic intercondylar fossa, shallow depression or groove. So this is an intercondylar fossa, and on the anterior side, you can imagine this is a surface in which the patella is going to rub, called the patellar surface. Last marking here is this little kind of nub here. This is called the adductor tubercle on the medial side, which your adductor longus muscle is going to attach, adductor magnus muscle is going to attach to. Let's take a look at all these structures again. Head, fovea capitis with the neck, greater trochanter, lesser trochanter with the intertrochanteric crest on the posterior side, intertrochanteric line on the anterior side, got the large shaft with the linea aspera, but right by here is the gluteal tuberosity. You get the medial and lateral condyles with the epicondyles on the side, and then the intercondylar fossa with the patellar surface, and then lastly the adductor tubercle, this little kind of bump right here.